Assalamu alaikum brothers. Today I have completed 4.61 kilometers and burn 453 kilocalories. So once we diagnose the patient with the diabetes, we start with the uh, life modification. So life modification means they should take low carbohydrate diets, and with that they do exercise. So we advise them exercise to do it half an hour exercise at the beginning. So jogging or walking for half an hour. That is 6 days per week. With that, we prescribe them metformin. So metformin is a good drug that's more than 100 years it has been using for this diabetic control. So these days the patients are very reluctant to take the carbohydrate, this metformin, because they are very scared that affect the kidney. So really the kidney is affected by the diabetes, so disease. So the kidney is affected by the disease. So there are complications. Nephropathy. So nephropathy means that affect the kidney, and also neuropathy and retinopathy we will see later. So these complications are there. So not due to the metformin. So people are very reluctant to take the metformin, but metformin is the only good drug that will accelerate the action of the insulin. So insulin is secreted by our body. So when we take metformin, that will increase the action of the insulin. The other these drugs for the diabetes are really uh, increase the secretion of the insulin by inducing the pancreas. So as we use for a long time other drugs, the body insulin will reduce. So only the metformin is a good drug. So it's not affecting the kidney, but it's secreted by. That means it's excreted by the kidney after using the drugs. So when the kidneys are affected by the disease, we have to reduce the dose of metformin, but we no need to stop the metformin. So people are very reluctant to take the metformin because they think that affect the kidneys. So really the kidneys are affected by the disease, not by the metformin. Once it's kidney affected by the disease, we can reduce the metformin dose as it affect the excreted by the kidney. With that, the metformin has more benefit effects in the cardiovascular and other system to reduce the body weight and all. So it's a very good drug. So you should not be reluctant to take the metformin. So if you are controlling your diabetic with the metformin and the life modification exercise and the diet with the metformin, you can have a very healthy life.